for me to kick it off,
I'm guessing it probably is. We'll maybe a few more people will join. I'll hide in the background as usual. Over to you, Aaron.
All right, over to me. All right, so good evening, everyone. Welcome to the November Grassroots Conference call. If we haven't had a chance to meet, my name's Aaron Oxley. I'm the Executive Director at Results UK. I do have to apologise in advance if my line's interrupted at all by some very loud bangs. As you probably are aware, it's bonfire night. My neighbours happen to be quite vigorous in celebrating the fact that Parliament was not blown up just a little over 300 years ago. Which of course reminds me, a big thank you to everyone who's chosen to join the call tonight instead of going off to Guy Fawkes celebrations, or maybe before, I don't know. But it does mean a lot that you're here, so thank you for making the time tonight. If there are any new people on the call this evening that want to introduce themselves, a very special welcome to you. Do you want to say hello or wave or anything like that? Oh, we've got Edinburgh. We've got lots. That's great.
Hello, Brighton.
Hi, Brighton. How you doing? We don't see you waving, but great to hear your voices. Wonderful to have you.
We're here, it's Corinne. Oh yeah, great to meet you all. It's Hugh here in Brighton. We've just joined as group leaders.
Fabulous, fabulous. Really, really great to have you. Hopefully, you've joined on a really, really good night. You'll hear all about it in just a minute, but you've joined at a really, really exciting moment in British history. For both the country and for international development, but let's jump into that. I think it's probably appropriate. So, because as a lot of you know, I do like to start this call with a bit of a review on how our work is going and how politics is affecting what we do. But thankfully, no matter how difficult we find the current political climate, we at Results don't approach Parliament the way that Guy Fawkes did. We like to think we're pretty good at finding people to work with, MPs, peers from all political parties who want to work with us on helping people in the poorest and most marginalised communities around the world gain their rights to health, education, economic opportunities, and to be able to use their political voices the way that you guys do all the time. And of course, everybody's talking about the general election and the dissolution of Parliament, which takes effect at midnight tonight. All of that has a massive impact on what we can and cannot do, which I'll come to in a minute. But before we get into all of that, we've got some other very exciting news that's a bit related to the dissolution of Parliament, as well as related to last month's action. We asked you to write to our Secretary of State for International Development, Alok Sharma MP, about the importance of global health institutions, which need renewed funding this year and next year. The most upcoming one of which was the Global Polio Eradication Initiative, or GPEI, which works, for those who are new, on channeling donor money from the UK and others towards bringing about the eradication of polio. Now, as if you're on the call last month, you probably remember that we did say we were fairly confident the UK was going to pledge to the Global Polio Eradication Initiative, but we didn't know exactly how much it would be, and we weren't sure exactly when they'd do it. Now, that can have a huge impact on how much other countries pledge, as we saw with the Global Fund, where we're to fight AIDS, TB, and malaria back earlier this year, where the UK's large early pledge absolutely helped bring other donors like Germany to the table. And just a reminder, the Germans pledged €1 billion to the Global Fund, so that really matters. On polio, we've been hoping to have some good news, either around World Polio Day on the 24th of October, that didn't happen, or in the weeks running up to the GPEI's replenishment conference, which is happening in Abu Dhabi in the United Arab Emirates on the 19th of November, 2 weeks from today. But guess what? At 2 p.m. this afternoon, our polio advocacy officer, Bruce Riley, received an email from a senior DFID civil servant, their polio lead, informing him that the UK was just about to pledge £400 million. That's the figure that we've been asking for. And that was very shortly followed by a press release from DFID itself confirming Secretary of State Alok Sharma has in fact made the pledge. This is fantastic news. I mean, just a really, really massive thank you to all of you who've taken action to work alongside ending and work towards ending this terrible disease forever. So alongside the announcement back in June of £1.4 billion for the Global Fund to fight AIDS, TB, and malaria from the UK, this really does show that our messages about needing to fund all of the global health institutions is really striking home with the government. And it's really powerful evidence that positive, targeted advocacy actually works. For those of you that want to read the government press release in full, literally hot off the presses this afternoon, we're going to paste a link to that in the chat box. Now, we actually had no idea that this announcement was coming today. We had an inkling it was a possibility, but weren't really, given the current political climate, expecting it at all. We had a strong suspicion that the election would mean the announcement could even be postponed until after the election, because of course, while you're in campaign mode, the government can't announce any new money. So it's really great news for us that this came out today. And I think this is colossal news. For this month's action, we suddenly found ourselves also not knowing what the election would mean for this month's November campaign action. And as many of you know, we are really clear and upfront that we never want to ask you guys to take an action unless we really sincerely believe it's going to have an impact on a political process and play a part in getting the change that we want to see in the world to actually happen. And the election means that after today, there will be no MPs. There'll only be prospective party candidates, or PPCs, some of whom will be the current MP. Ministers keep their jobs during the election period, and the government, that's because the government has to keep working. But by convention, no new policy or funding commitments are made during the election period, which is a major reason why we got the polio announcement this afternoon, because they must have decided there was no way they could sneak it out under the radar in 2 weeks' time while everybody was busy campaigning. So this is actually really good. Now, we'd heard that a decision was also likely to be made inside the Department for International Development in the next few weeks on the UK's level of financial support to Gavi, the Vaccine Alliance. So we prepared this month's action materials on the basis that there was a good chance that your influence would help that decision be as positive as it can be. Now, this is really important because, as we'll hear from our guest speaker shortly, a strong UK pledge to Gavi is vital, and I'll leave it to our guests to explain why. However, when the election was called, we stopped and thought, look, crikey, there won't be any MPs to write to. Is this action still worth doing? MPs are going to be candidates. They're going to be out fighting for their seats. Ministers will also be focused on winning the election. They're not allowed to do any policy-related stuff for government. Global poverty is likely to be very low down on everyone's list of priorities. However, we decided to stick with this action, but instead of writing to the minister or contacting your MP, as we often ask you to do, we thought it would be appropriate to write to the department's top civil servant. He's the permanent secretary, Matthew Rycroft. Now, it's ministers who hold the purse strings, who write the checks, and who make the decisions. But we also know that the top levels of the civil service are involved in pulling together proposals for how to spend resources, and it's going to be Matthew Rycroft's job after the election to ensure that the new ministerial team, whoever that is briefed on what's going on in the department, what's coming up, and in particular, given that the UK is hosting the Gavi Pledging Conference, that they understand the value of funding vaccination efforts around the world. So even though we aren't expecting a decision on Gavi funding to be announced publicly until next year, we believe that a firm, perhaps not final, but very firm decision inside the department will have to come much sooner than that. So in spite of the election, now is still a really good time to take action and say, well, you think this issue matters. Now, some of you will have met Matthew Rycroft. We had a meeting with him in Whitehall the week after this year's national conference. Now, while civil servants don't generally see interacting with the public as being central to their roles in the way that, say, a minister would, Mr. Rycroft is someone who's definitely up for interaction with the public. In fact, I know one or two of you follow him on Twitter. You've tweeted back and forth with him. And we're really clear that engagement with him, where we show how we understand and respect his role in the process as a senior civil servant, will be really valuable in getting to the final decision we need out of the next UK government. Having said all of this, please do contact your parliamentary candidates as well if you want to, as some of you have done in previous elections. Some of them may well end up in Parliament and be potential champions for international development, but just be aware of the strict rules around what is called in the jargon non-party campaigners and what they can and can't do under the Lobbying Act. And of course, this all stems from the fact that Results works with everyone and we're absolutely politically neutral in that respect. So I mentioned this on the call last month, but for those of you that weren't on the call, and there's a reminder for those that were, there's particular scrutiny of organizations like ours, charities, at election time, on top of our ongoing obligations to be politically impartial at all times. So if you're planning to do anything on behalf of results between now and the 12th of December, please make sure that you understand the rules. Now, we've included a guidance sheet with this month's action materials, so please do read that. I think I'm going to pop a link to that in the chat box right now. But let me talk you through it. The main implications for us are 3. Firstly, if you contact any of the parliamentary candidates in your constituency, then you must attempt to contact all of them and give them all the same chance to engage with you. This is particularly around public interactions. The sitting MP is no different than any other candidate, and you also have to try and reach them all, even ones you think are likely to disagree with you, or those that you think don't have much of a chance to winning. I don't make the rules, those just happen to be the rules. Secondly, when representing results, you really can't publicly say anything that could be reasonably construed as trying to persuade the public to vote for or against one or the other party. So although the parties may have different views on aid or on the 0.7% spending commitment, for example, we must not compare parties' positions publicly. This refers to all public communications that you do. For example, if you organise or attend a local hustings event, it also includes social media. This month, we're also suggesting that your group might want to host an advocacy evening, inviting new people to get involved in letter writing for the first time. Again, just think about how you'll be introducing what Results is and does, and be especially careful about describing how we work with politicians of all political stripes and colours. Thirdly, it's really important that all of what I've just said doesn't affect your rights as individuals to express your personal views and to take part in big P political campaigning. We only ask that if you do this, you make it absolutely clear that this is in your private personal capacity and that no one could reasonably assume that you're speaking for Results or because Results was telling you to. So for example, if you're active on social media, make sure that you don't use the same social media accounts for sharing your party political views as the ones that you show your support for Results issues. You can land us in quite a lot of hot water if you do that kind of stuff. But again, key thing is we absolutely don't want your work for Results to get in the way of any work that you want to do politically. So we really want to extend all the help that we can to help you navigate all of that. So if you've got any queries at all about any of this, just contact the office. We'll make sure you get the answers that you need. That's it from me right now. One last huge thank you to all of you for the polio announcement. It's really, really massive. It was very last minute, so I really haven't had a chance to incorporate everything, absolutely everything I wanted to say in my talking points, but we're just really thrilled, and just thank you so much. I'm going to hand over to Della to give the usual roundup of your advocacy over the last month. Over to you, Della.
Thank you, Aaron. I just wanted to echo your thanks as well to everyone who's involved in the GPI campaign. I know that between us, we sent at least 13 letters to Andrew Morrison, the Minister of State for International Development, back in July on polio. So thanks for all your efforts on that. There's also the letters you've been sending throughout October to Alok Sharma on the importance of the UK investments in global health initiatives. So far, I know we've had at least 15 letters sent, which is amazing. And that includes some people taking their first ever action with Results, so extra amazing. A few of you have sent me some encouraging responses from DFID. If you haven't forwarded any responses to me yet, please keep doing that. Also, Gavi gave us a shout out on Twitter earlier. If you didn't see that, then it's worth having a look at. So it was nice to get some recognition for all our efforts from them. There's a few things been going on around the network, so I wanted to ask a couple of group members if they wanted to share. I know that the London group held an advocacy evening a couple of weeks ago. Richard's on the call, so I wondered if you'd want to share a bit about how that went.
Yeah, no, it went really great. We had, I think, 7 new volunteers turn up for the meeting. We managed to get in 9 letters, the Alok Sharma letters to DFID on last month's actions. That was really great. It was really encouraging to see people really keen to take part. And we're hoping to organise another one for, I think, next Tuesday. for this month's action. So it's been really positive the last few months. Yeah.
Amazing. Thanks, Richard, and well done. I know Zoe from the Manchester group has been busy encouraging other people to write to Alok Sharma as well. Do we have Zoe on the call tonight? Hi. Do you want to tell me a little bit about, I got an amazing letter from one of your students, and I wanted to ask what inspired you to get them involved and how you convinced them, basically.
I've been working at this school now for 3 years, and I've now got the role of charities coordinator, which has sort of inspired me to get a bit more proactive with talking about results, other things. So there was a volunteering fair for all our sixth formers not that long ago, and I used it as a chance to set up a little stall for results, so that anyone who wanted to volunteer or was interested could get in touch with me. And I've had 4 students express interest, and one of them completed the full letter and sent it off last month. So I'm going to keep emailing and getting in touch with the other 3, and hopefully just get a few more with time sending things off.
Thank you so much. That's amazing. And it was such a great letter as well, I should emphasize. Got some bright students there, definitely. Thanks for sharing. Also, the pool group, I know, ran an event recently. Do you want to talk a little bit about how that went? We got anyone on the line? I think we have Helen and Reg, but they might be on mute. Ah, here we go.
Hello, yes, it's Helen here. It was Deirdre who did it all, actually. Okay. She went up to people and asked them if they'd like to sign postcards for us, the ones we were doing in the summer, asking to support overseas aid, asking their MP to support overseas aid. And we have a few postcards signed. We used a game with 100 pennies on it to show that 0.7% was a very tiny amount of money that goes overseas every year. And we were very lucky in that most of the people in the hall at the event were very pro overseas aid. So yes, we've got a lot more postcards signed, and we're going to wait until after the election now and send them to the newly elected MPs.
Thank you. That sounds great. I love your little trick with the pennies. I think I'm definitely going to steal your idea for an upcoming fair.
It was Harriet's idea. She's sitting there as well.
Thank you, Harriet. So I wanted to welcome as well the 2 new members from Brighton who are hopefully going to get the group up and running again in Brighton. So thanks so much for joining a call for the first time. Does anyone else want to share any campaigning that they've been up to this month before I move on to some other updates? I can't see anyone unmuting themselves, so feel free to interrupt me if you do want to chip in. I wanted to say thanks as well to everyone who invited their MPs to a World Food Day parliamentary event that the Nutrition for Growth All-Party Parliamentary Group organised a couple of weeks ago. At short notice, it was a lot to ask for MPs to attend, but it did serve as an amazing opportunity to remind them that you understand the value of investing in nutrition. I know Sophia, who is one of the London-based advocates, got a really positive response from her MP, Ellie Reeves, who said, "I can assure you I'll continue to press DFID on this issue at every opportunity," and was really positive about campaigning for nutrition, so that was great. If you had any other good responses, please let me know. A couple of other things I wanted to flag were a new report that Results has produced on which analyzes TB treatment in relation to universal health coverage and how it's implemented at the country level. It's definitely worth a read. I'll put a link in the chat box for you. Also, events-wise, there's a film screening coming up that we've organised in collaboration with the London School of Hygiene and Tropical Medicine. It's free. It's a film about multi-drug resistant TB, but it's cheerier than it sounds. It's about some inspiring doctors that actually contracted the disease while they were at work. And yeah, definitely worth coming along if you're around. I'll put a link in the chat box again. And lastly, I wanted to remind you that we've got our training coming up on Saturday, the 23rd of November, where we'll cover how to engage your MPs, influence Parliament, and run successful and inclusive groups. So good for new and existing members, I think. It's free again, lunch is provided, and I was told by the venue that they stock the best bread in Sheffield, so I'm really looking forward to it. We've got an Eventbrite link that you can sign up to, and we can also help reimburse you for travel because it's a long way to go for a lot of you. So do let me know if you need that sorted. And that's all from me, I think. I'll hand back over to you, Aaron.
Thanks a lot, Della. That's one of my favourite bits of the call. So great to hear what everybody's up to. On to the topic of tonight's call. As I mentioned earlier, tonight we're talking about the need to make sure that we get Gavi, the Vaccine Alliance, fully funded, and how that making sure that it has the resources it needs will achieve amazing things in terms of disease prevention and reaching children in some of the remotest places in the world with life-saving vaccinations. It's part of our brick by brick messaging. Gavi is one of the vital building blocks of achieving the goal of universal health coverage. So to discuss this, we've invited Global Citizens Global Policy and Advocacy Manager for the UK, Ted Elgar, to speak to us tonight. You'll see, I think he's already joined. So great to have you here, Ted. Global Citizen is an organisation that we've worked very closely alongside on a number of issues over the years. And currently on all of the global health replenishments, we've been working pretty closely together this year too. In his role, Ted leads Global Citizen's UK government and policy work. He manages their day-to-day work with DFID, other government departments, and with parliamentarians. Before joining Global Citizen, Ted worked with APCO Worldwide, doing a range of public affairs work for health, tech, and NGO clients after a period working for Human Rights Watch in Geneva. Ted has a degree in history and politics from Oxford. Ted, welcome to the Results Grassroots conference call. Massive thank you for taking the time out of your evening to be here with us. We really appreciate it. Hopefully this is more fun than letting off firecrackers. Thank you for addressing our Grassroots network. You've heard already a bit about what they're all up to, what they're all about, and the things they're all really keen to do. And also, they're obviously really excited to hear about the political opportunity we have in the next few months so that Gavi can do its job. You'll see we've got people from Edinburgh and Linlithgow in the north to Poole in the south. We've got folks from all over the UK, some very new people, but also some very, very experienced advocates as well. Ted, we're going to start with 3 pre-arranged questions for you, as we always do, and then we'll open up for the questions from the floor. For those of you that are on your computers, as always, please feel free to ask questions using the chat function at the side of your screen. If you'd rather not do that, you can of course unmute yourself and shout out questions at some stage. We'll do that as well, and that's particularly useful for those of you that are on phones. And in addition, if you'd like to text message in, the number tonight is 0777 56 11178. That's 0777 56 11178 if you can't use the chat and don't want to yell. One final thing for those on the phones, if you're on the phone, please mute yourself using *6 and unmute with *6 when you want to speak. Otherwise, you might run into a bit of trouble. Ted, but before we kick into the questions, I'm going to start by what we often ask our guest speakers. I'm going to ask you to say a little bit about yourself. How did you get into international development advocacy in the first place? What is the best part of your work at Global Citizen? What makes your job really worthwhile?
Can you hear me okay? Brilliant. Okay. Lovely to meet you all. I guess before I answer your question, I'm just going to apologize if there are fireworks or cats that you can hear, because unfortunately the one is very much affecting the other in my flat at the moment. How did I get into working in development stuff? I think, well, so for me initially, I worked more on the kind of public policy side of things. I ended up working for Global Citizen through my previous job. And I think one of the things that I found very uplifting about it was how much of a good news story it was relative to all of the other things that I worked on, kind of the stories of progress, and the kind of phenomenal ways in which the world has changed for the better in my lifetime, particularly, were kind of just great cause for hope and made me feel really good about things. And were kind of marked contrast to lots of the other things going on in the world. So I really enjoyed that. In terms of the best things about my job, I always think the most exciting thing is meeting people who are doing just the most amazing things for children, people living in kind of marginalized communities around the world, you know, vaccinators who are crossing mountains in winter to deliver polio vaccines to children who would otherwise run the risk of contracting polio, you know, healthcare workers who are walking thousands of miles to deliver safe births for people who would otherwise run the risk of preventable death. Lots of those individual stories are really exciting and just incredibly kind of moving. So those are some of the things I enjoy most about my job.
That's great, Ted. That is, I'm sure that's all. This is one of my favorite parts of the call, actually. And it's really interesting to hear how you got involved and excited about the same mission that many people that are on this call are on, and how what you're doing fits alongside that we do. So we're going to go to our pre-prepared questions, and just a reminder to introduce yourself before asking Ted your question. The first question tonight comes from Edinburgh.
Hi.
Go ahead, Edinburgh.
Hi there. So the UK. Can you hear me? Oh, the internet is. Oh no.
Try again. We can hear you.
You can. Okay. Hiya. So we just wanted to ask. The UK is responsible for over a quarter of Gavi's funding. And why does the UK play such a big role in supporting Gavi's work?
It's a good question because it's an awful lot of money. I think there are three reasons that I would highlight in particular why the UK has given quite so much money to Gavi since it was set up in 2000. And those are because of how kind of effectively it's shown it can help reduce preventable deaths. So since Gavi was created in 2000, they've contributed to immunizing about 650 million children against diseases like pneumonia, measles, meningitis, diarrhea, some of the kind of biggest causes of child mortality. In doing that, they've helped to prevent 9 million future deaths. So they've shown themselves to be an incredibly effective delivery partner when it comes to kind of saving the lives of children and people living in extreme poverty around the world. A second reason is that they've also shown that they're an incredible they represent incredible value for money when it comes to spending UK aid money. So for every dollar that the UK invests in Gavi, there's been a return of about $21. And if you look at the broader kind of benefits across the board, it rises to $54. So I think for DFID, which is an aid agency that has a lot of money to spend, but is incredibly conscious that often, you know, the public here in the UK aren't necessarily that keen on the way it spends that money or are very skeptical about the effectiveness. The value for money case has been really big for DFID over the last couple of decades. And I think the third reason I would cite for the UK having spent as much money as it has is that, going back to what you were saying, Aaron, about kind of the brick by brick approach to health, Gavi has shown how good it is as the kind of foundation of primary healthcare, or one part of that jigsaw. So routine immunization services reach 4 out of 5 kids in Gavi eligible countries. That's more than any other health service. So if you were looking to build kind of robust health systems that work kind of across the board to help reduce extreme poverty, preventable deaths, Gavi is really one of the best kind of mechanisms for doing that. And they're kind of the gold standard relative to some other kind of things that DFID invests in for kind of ways to spend UK aid money.
Thanks, Ted. A wonderfully clear answer. We're going to jump straight across to question number 2 from our ghostly friends up in Birmingham.
Yes, sorry about the webcam. The question is, what's the timetable for Gavi's replenishment?
It's a good question, and it's changed slightly because of the election. So as you were saying, Aaron, we'd hoped that the UK would make this decision before Christmas. And sadly, that shifted. So we think that the UK kind of internally will make a decision on how much money they want to give to DFID by kind of late January, February time. That's the timeframe that the department are presenting as realistic for them. But as you were saying, Aaron, the kind of internal conversation has already started. So there's the team within DFID that work most closely on Gavi, who are already working on the kind of business case for the UK's investment, and that will go up to people like Matthew Rycroft before it goes to ministers. So their hope is that in December, when someone is the DFID Secretary of State, whether it's Alok Sharma or someone else, or Dan Carden from the Labour Party, they will have things kind of lined up to begin the ministerial process. From January, Gavi want to start kind of their more public campaigning on the $7.4 billion that they're hoping to raise in total across a huge range of different donors. And, they'll have asks out there for pharmaceutical companies and Gavi partner countries as well. And we think that the UK may reasonably, or could reasonably be expected to make its commitment to Gavi in kind of World Immunization Week next year. So kind of March, April time looks like the best case scenario for when the UK is going to pledge their money to Gavi. The conference itself will happen in June.
Thanks, Ted. That's really clear. And I think particularly important to keep an eye on this, given how rapidly politics is moving. We're going to go down to Brighton for the third question.
Hi, Ted. Our question is, with advances in vaccination coverage stagnating, are Gavi plans?
Sorry, Brighton, could you say the last bit of the question again? I think we missed it.
Yeah, sure. So with advances in vaccination coverage stagnating, are Gavi's plans realistic?
It's a really good question. And I think that it's in many ways the challenge for Gavi over the current strategic period that it's faced. So in 2015, when they did this last time, when they raised funds from donors, they set out this headline goal of immunizing 198 million children between 2016 and 2020. And it looks like they're going to reach that figure. And in the process, they are going to save between 5 and 6 million lives. So they're meeting the kind of top line goal that they'd set for this period. The problem that they've faced is that the broader kind of vaccination landscape hasn't been static over this period of time. That's partly because population growth has meant that there are more kids to vaccinate, so they can continue to hit these really high numbers when it comes to, vaccinating children without meeting their targets on equity. And that's kind of what we've seen happening. The equity challenge has been really big and it's continued to grow. Partly that's because more people are moving to cities and you see large pockets of unimmunized kids in urban slums who are unaccounted for and end up not getting vaccinated. And you also see things like more forced migration, whether that's because of war or climate change. It's become harder for them to kind of tread water in some ways. The final thing I'd say on that is that there have been modest improvements in coverage. So when people say it's stagnated, it has gone up a little bit, but they've done it against quite a complicated kind of landscape. So what they're doing is still really good, but there is more to do on equity to make sure that we're reaching the kind of most marginalized children.
All right, Ted, thanks. 3 very clear, very succinct answers. Really, really helpful way to kick us off. I'm going to open the floor to anyone who'd like to ask a question in all the usual ways I mentioned earlier. Do we have any in the chat box? Do we have anybody that wants to unmute themselves and ask a question? For those on the telephones, if you'd rather text in or even in the room, it's 0777 56 11178. That's 0777 56 11178. So does anybody have a question for Ted?
Aaron, there's a question or comments in the chat box from Vicky in Birmingham, which might be worth just sharing that for people who aren't able to see it, for those on the phones.
Sure. Okay. Right. I saw those. Those were about the TB stuff, though. So I was going to leave them maybe, but to the end, if that's okay. Unless people don't have any questions for Ted. I mean, you know, we've got one of the sector's big brains on the call, folks. I mean, we wanna ask them the toughest questions.
I'll ask one then.
Go ahead.
What do you see as the biggest barriers to Gavi's work at the moment?
I think that the equity challenge is the one that's really coming through, and that, you know, historically what Gavi has done has been focus on reducing the price of vaccines so that they're more accessible to people in poorer countries. But over the course of their existence, they've also introduced lots of new vaccines, and that's kind of shifted to equity in the last strategic period, the one we're in now. And it's also the focus of the next strategic period. So it's really about kind of meeting, like ensuring those vaccines are delivered to the hardest to reach children. And pneumonia is a really good example of this. I'm conscious we're talking about this because of kind of World Pneumonia Day. You know, lots of the children who receive the pneumococcal conjugate vaccine, which is the one that prevents bacterial pneumonia, often the people that get that vaccine through Gavi support are the relatively wealthier people within poor countries. So the poorest children who are the most kind of liable to the background risks that, you know, can lead to pneumonia are often the ones that are being missed at the moment. So there's a really strong argument for doing more on, you know, reaching the hardest to reach children. And that's going to be really difficult because it will mean having to get better health data on populations which move around a lot or don't have much in the way of interactions with existing health services. It's going to mean, you know, trying to do more in kind of fragile and conflict affected areas. I know you guys have done stuff on polio previously, and Afghanistan is a really good example of this. There's quite a lot of conflict that means people move around all the time. So actually delivering vaccines to people in that context is really difficult. And that's some of the kind of challenges that Gavi's facing. So those are probably what I would say are being, you know, the biggest challenge for the next 4 years, 5 years of Gavi's work.
Great, thanks, Ted. I've had a question come in via text. It's from Deirdre in Poole. And Deirdre asks, what action might Gavi take about emerging global issues such as people's resistance to vaccines?
So it's a question that lots of people are asking at the moment because there's so much news coverage on kind of vaccine skepticism. I think we're all more conscious of it at the moment. And I think it's a really very varied landscape. The reasons that people access or don't access vaccines are quite kind of different in lots of the different environments that Gavi works in. Generally speaking, the problem is more one of access than it is of reluctance to take the service. So when people aren't getting vaccinated in lots of Gavi partner countries, it's not because they don't, you know, they don't want to be vaccinated. It's because they don't have access to that service. That said, there are pockets within particular geographical areas or countries where vaccine hesitancy has been a thing. Nigeria is a really good example of this on the polio front, where there have been kind of rumor campaigns at different points that vaccinators have been linked to, you know, all kinds of unpleasant things, which aren't true, but it has made the kind of picture more complicated. So Gavi is not centrally focused on kind of vaccine skepticism because it's not the major challenge that they're facing, but it's very much affecting the conversation about vaccines here in the UK. And DFID talk about it sometimes because they're aware that for most of us, when we hear conversations about vaccines, you know, whether or not it's measles or meningitis or whatever, we're thinking about news stories that are current here in the UK about more people getting those diseases or more people rejecting or not having had those vaccines.
Thanks, Ted. I've actually got another question coming out. Somebody didn't sign it, so I'm not sure who it's from. But it says, you've talked about polio and vaccines tonight. You've talked about the actions on Gavi. Are there links between the two of them? And if so, what are they?
So there are lots of links between the two. And it's a really good example of the kind of brick by brick approach that Results talk about so much in their reports and all of the policy material they put out. I think the thing about investments in Gavi that's good to think about is that really what Gavi investments do is create health infrastructure that has a broader application. So that can be data on, where children are, whether or not they've been vaccinated. It can be healthcare infrastructure in the form of cold chain, because most vaccines have to be remain refrigerated between the point of production and the point of delivery. It can be in the form of kind of community healthcare workers or networks of healthcare workers who are actually able to physically go and deliver these vaccines. So there are really strong links between the work of polio eradication and the work that Gavi does. And Gavi has actually just joined the Global Polio Eradication Initiative's board. So it's joined the other partners working on that as the 6th member. So going forward, they'll be working even more closely together.
That's great. Thanks, Ted. Do I see Macclesfield trying to get the mute button off?
Yes, you do. Hi.
Go ahead, Macclesfield.
The question we have is, thanks very much for all your answers, Ted. They've been really clear and to the point. The question we have is, it's great that Gavi go into all these countries and do all this wonderful work, but what contribution do the countries themselves make to this program as well? If that makes sense.
Yeah, no, it's a really good question. And one of the things that Gavi is proudest of about the work it does is that it's very much a kind of country-led initiative. So although Gavi raise funds and they use those to try and lower the prices of vaccines, you won't see people in Gavi partner countries wearing, Gavi uniform or whatever, employed directly by Gavi. They work through partners and often through civil society groups within particular countries, and have to be integrated in kind of healthcare systems. The other thing that Gavi partner countries do that's really good through the Gavi model is that they are incentivized to raise their own money to spend on healthcare. So Gavi will give them a kind of certain contribution, and those countries themselves have to come up with what's called co-financing funds. So they have to kind of allocate their own money. And over time, the amount of money that partner countries contribute rises as they get richer. So the goal is that over their period of work with Gavi, they will be increasing the amount of money every year that they are allocating to spend on this service, such that by the point at which they stop working with Gavi, they're able to self-finance vaccination services and the broader health infrastructure that that implies. So countries are absolutely crucial to it. They're very much in the driving seat. And that hopefully will come through between now and the replenishment next year.
Thanks, Ted. I'm going to take Chair's prerogative and ask a question myself. Actually, I think one of the things, and I'd be actually really interested in your take on this. So one of the things we pushed the UK government to do was to pledge early and pledge big to the Global Fund so that other countries would follow its example. What we've seen just today is that the UK has pledged early and pledged big to the Global Polio Eradication Initiative, which will, we're pretty confident, open up a lot of space for the other countries to pledge big to polio as well. But we're hosting Gavi. And, quite often what we've seen in the past is when a country hosts a pledging conference, they sometimes like to hold their pledge back to the last minute so they can do horse trading with other governments to try and get them over the line at the last minute. We saw that in Lyon last month for the Global Fund replenishment, where Macron literally said, nobody's leaving this room until you stump up the money, and then went around and browbeat all of the countries individually, increasing the French pledge in line with other countries coming with a bit like a telethon. It was pretty impressive to watch. What do you think is the advantage in us going early to Rycroft with the work that we're doing tonight, and how that might influence, the UK strategy around potentially pledging early and pledging big to Gavi, even though we're the host? Is that going to hamper our ability to horse trade, or how is this all going to play out, do you think?
I think, so I suppose that there are advantages, mostly there are lots of advantages in pledging early, as you say. And I think the general feeling is, if that's possible, that would be a really good thing to see from the UK, because it pressures other donors to give more, because no one wants to be noticeably the least generous, or, the one country that isn't showing up for this great partner in global health. I think there's a lot of concern about the current political environment among, you know, all of us in the development sector and what it means for the decision-making process. So I think the value in, you know, results activists writing to Matthew Rycroft now is really that we're getting everything in place as a sector so that when we have those political decision makers in place, you know, the department is on board, everyone within it is on the same page, they're making the same case to their political bosses within the department, and that when it comes to making those cases directly to ministers, you know, ministers aren't in doubt that this is something that the UK public really support, because intuitively they understand, you know, the value of vaccines, that vaccines work, and also that, you know, people want our aid money spent on this kind of thing.
Great, thanks, Ted. Always great to have a strategy validated by somebody else as well, because yeah, I do think, you know, the benefits of going early, particularly given how big we hope the UK pledge will be, will certainly set a high bar, I would think. Oh wow, we've got a very big bunch of white space that's just appeared in the chat box. Hang on a second. Right, okay. So Jill just pasted into the chat box a tweet from Matthew Rycroft himself from 6.6 hours ago. I think there was a photo attached, which is why there's a big gap. Maybe Jill, if you can get the actual link to the tweet, you could drop that in and people could follow the link. Because I remember this got shared around the office as well. Matthew Rycroft said just today, bringing together different UK staff this morning as we prepare for the pre-election period. Proud to lead this fantastic department as we look ahead to an important year, the UK Africa Investment Summit in January, the Gavi Pledging Conference, and the COP26 in late 2020. So Gavi is already on his radar. I mean, we absolutely would expect it to be, of course. And he's already tweeting about it quite publicly. So yeah, just more reinforcement that showing him that the public is paying attention and that want him to be as ambitious as possible as he can be as a civil servant rather than as a minister, because at the end of the day, the ministers make the decisions, I think is really, really important and quite timely. I've got a question from Della. She says, if you scroll up in the chat box, Ted, you can see it for yourself as well. Della says, Ted, to go back a few steps, how would you sum up what Gavi is/does in one sentence? A nice short answer, I'm guessing, for someone who's completely new to global health. For example, who's coming along to a results advocacy evening for the very first time.
If I had to sum it up in one sentence, I think the sentence I would go is, they make sure that children from some of the poorest backgrounds have the same access or more equal access to the core, most important set of vaccines as children in the richest countries. I think that's at their heart what Gavi is all about.
That's great. Thanks, Ted. Yeah, I think that's do you want to, I'm going to come in, does somebody want to come in off the back of that question? Because if you don't, I actually have something that I'd like to ask Ted to expand on in his answer. Does anybody else have a question before I do that?
Kind of have a question from Brighton.
Oh, go ahead, Brighton.
Ted, it would be cool to get your take on, you know, if we were being advocates at a grassroots level, how would you explain the value of UK investments in this global health initiative? Well, why does it affect an individual in England or the UK?
I mean, I think that there are lots of ways. Like, there's a kind of long-term way in which it affects all of us. You know, we all benefit from living in a richer world, in which people don't suffer from the kind of preventable and debilitating diseases that keep people locked in poverty. How does it affect us in other ways? I think it can vary a bit from, you know, disease to disease. Some of the diseases that Gavi works on are really infectious. So some of them, there's a kind of global health security angle. You know, we all suffer some degree of exposure to global pandemics, and some of what Gavi does helps to reduce the risks of those. So there's also a kind of slightly shorter term kind of national or personal interest that we can have in some of these things as well. But I think the really big argument for it, you know, for Gavi is not so much about national interest or any of that kind of stuff. It's more the kind of moral value of what they do, because I think none of us would think that children shouldn't have access to that core package of basic services that we know can help them live safe and healthy lives based on where they're born. And I think it's that kind of moral case for it that's, you know, so many of us find really compelling. There are lots of really great economic arguments as well for what Gavi does and how it's reduced the prices of vaccines and how it's helped, you know, poorer countries increase their own finance for health systems and all of that kind of stuff. But for me, it's the moral one that really kind of sticks with me.
Yeah, Ted, that's a great answer, and I'd add to it. You know, one of my party tricks is to ask somebody when they say, "What do I work on?" I ask them to look at their watch and ask them if the minute hand is on an even minute or an odd minute. And because it's a party trick, it doesn't matter what their answer is. I just say every time that hand ticks around to the next even or odd minute, whichever one it is, the UK taxpayers just saved another life through Gavi. And you know, and I think that is just phenomenally compelling. Every 2 minutes of every day, whether you're awake or asleep, the UK taxpayer through DFID is saving lives, saving a life with Gavi. And that's just the UK's contribution. Gavi itself saves even way more lives than that. It's absolutely fabulous. So those kinds of ways of making the big numbers a bit more real for people can sometimes also be really, really helpful. Results Norwich has a question. They've put that in the chat box. And Ted, this is a really easy one for you. When we all know the value of vaccines, why in the year 2019 are only 11% of children receiving all of the 11 WHO recommended vaccines before their first birthday?
So the answer is that usually the kind of children who receive no vaccines are living in places where they're not accessing any kind of healthcare services at all. They're people who are caught up in conflict and therefore don't have any access to healthcare, or if they do, it's very piecemeal, such that they don't actually get vaccinated. I mean, some children that figure represents, for instance, might have one dose of a vaccine that requires multiple doses to actually work, for instance. Some of those people, some of those children, you know, end up in urban slums, which are a really big problem when it comes to vaccinating, because, you know, there aren't reliable networks of data collection or healthcare workers going into some of those places to provide that service. I think the crucial thing, like, to come back to with all of these things is that the primary barrier is access. And the causes of a lack of access can be really varied. But that's a recurrent theme that accounts for that. And reaching some of these children is going to be really hard. And sometimes it's going to cost, you know, more money. It's going to require us to develop different delivery platforms to make sure that we are reaching them. I'm sure if you guys follow any kind of social media stuff around polio, you'll see footage of like what in practice some of the work of polio vaccinators involves in places like, you know, rural Afghanistan or on the border with Pakistan. It involves people trekking over mountains, crossing rivers, you know, trudging through snow. Like it's very hard. And in many ways, I think the other thing to say about it is that figure is also perversely a record of real success. It's lower than it's ever been. So although there's a lot still to do, that is actual real progress. We've never been in a better place on it, but we obviously, you know, can't stop yet.
Great, thanks, Ted. We're going to have to stop this call pretty soon, so we've probably only got time for one or two more questions. I see a finger up, Rhiannon. Do you want to go ahead?
Yeah, that's me. Sorry, I'm not actually from Results UK. I'm just like hopping on to the very interesting webinar. I was just wondering, so in terms of Gavi and its structure as a public-private partnership, you know, we're seeing those pop up all over the global health environment. It seems like it's been, well, it clearly has been an extremely successful model of public-private partnership. And I was wondering what your opinions were on what was it about the Gavi model that has made it so successful, especially in things like developing vaccines and getting the price lower, and what lessons can we learn from this looking at other public-private partnerships to make sure that they are also equity focused, for example?
So it's a really, really good question on how this kind of relates to other, like what the private-public partnership has done well. Part of the answer there is reduce the price of vaccines. And one of the ways that they've done that is by increasing the quantity they're buying for. So Gavi, through UNICEF, procure an enormous percentage of the world's vaccines for the poorest countries. And that's allowed pharmaceutical companies to reduce the cost and still like make some profit on it, because when you're buying more, you can charge a bit less, and still, you know, that can still be a sustainable thing for pharmaceutical companies. So that's been really good. The other thing about it that's been really good is that I guess there are a couple of ways in which you can reduce prices for things like vaccines. There are ways which can have accidental, really harmful consequences. So if you just make pharmaceuticals, companies not make a profit, for instance, and they've already produced a load of vaccines, you might be able to buy that one round of vaccines. But like what you really want is a reliable supply. And what Gavi's been really good at is what they call market shaping, which is really long-term, allowing pharmaceutical companies to be confident about the price and quantity of vaccines that they're going to be making, such that they've felt able to reduce the price for the countries, the lowest income group. So that's been a really positive thing, I would say. But you know, it's not without its criticism. I don't want to say that it can't be better. It's something that civil society organisations like all of ours have to keep a watchful eye on.
I think one thing we might do is I'll try and rustle up a link or two to drop into the chat box, or to send around any follow-up emails that link to Gavi's own materials around market shaping as well. If that's not already in the background materials, it slipped my mind if they are or not. Because you can clearly see how they've increased the number, because producing a vaccine is really hard. It's very different than producing a pill. There's no such thing as a generic vaccine. So you've got to go through quite a rigmarole to produce a vaccine. So it's quite hard to get a large number of companies all competing to produce and keep and therefore help push the price down. And that's some of the market shaping things that Ted's been talking about. You know, because all of a sudden when you've got two organizations that are both trying to produce a vaccine cheaper than the other one, while still maintaining strict WHO quality standards, that can then help push the price down. And they're not going to do that if they're not sure about how much they're going to sell or how big the market is. And if you've got Gavi buying tens or hundreds of millions of doses of the vaccine, they can help shape that market to drive down the price. So we'll try and rustle you up a link for that in the next 3 minutes before the call ends. Do we have any, oh, there we go. Okay, it's just gone up in the chat. We'll try and get you the exact link. Do we have any final questions for the last 2 minutes? We only have time for one more, and it will need a relatively short answer.
I have a question from Linlithgow.
Go ahead, Linlithgow.
Ever since I heard of Gavi, it was associated with the name of Bill Gates. Is he still very enthusiastic? Will he be stomping around the globe, rustling up more funds over the next few months?
Hopefully he'll be both stomping around to raise more funds and giving some of his own as well. Yeah, he's very much still involved, I think. And thank goodness he is.
Yeah, I think I can confirm that as well. A number of our staff were actually visiting the Bill and Melinda Gates London offices just this afternoon, chatting to their team about what the next few months look like for the Gavi replenishment. So they're pretty keen. I'm betting Bill's going to be on a plane to London next year for the replenishment. I'd bet anything on it.
What are the proportions of funds that come from America or from China, please?
The US has historically been quite a considerable donor to Gavi. They've been one of their largest. The Gates Foundation also account for a very large share of the amount of money that they get. China have given them money previously, but not very much, because they're not particularly generous donors when it comes to development spending. But both the USA and the Gates Foundation have contributed lots.
Indeed, which is great, and we expect and hope that they'll contribute even more. I'm really sorry, but we are out of time. We've got to the top of the hour. It has actually flown past. Some really, really smart questions and some really great answers. Just a big thank you, Ted, for taking time out on Bonfire Night to share all of your experience and knowledge with us on this to help us get to a really strong Gavi replenishment. So yeah, big thanks from us.
Not at all. Lovely to meet you all, and good luck with your actions. I hope they all go brilliantly.
Thanks, Ted.
Thanks,
Ted.
Bye.
So I really hope that everybody on the call is going to be able to play your part with all of this. We've got a bit of time before it's going to happen, but things are moving fast in UK politics. And as we sort of said, the action this month is all about making sure we've done all of the groundwork possible to get the biggest and best pledge out of the UK to support Gavi and to really make sure that we can continue its really fabulous work on vaccinating kids in all around the world. So thanks for joining the call. Thanks for everything that you're doing to ensure the funding, not just of Gavi, but of the UK's global health efforts more broadly. I've certainly had a fun time tonight. I hope you all have as well. Good luck with everything that you're doing, whether you write a letter yourself or if you organise an advocacy evening to help get even more people to write in as well. Just thank you. And there are a lot of kids that are going to get immunised against polio because of the UK and because of your work. That thank you to, even though you will never meet them. We push ahead. Good night from me. I hope you really enjoy the rest of your evenings. Take care, everybody.